My name is Alexis Moberger, and I'm the co founder of Her Health Voice. And I am thrilled to welcome you to today's program, Living with Endometriosis Real Talk on Managing Pain, Nutrition, and Taking Control. Here at Her Health Voice, we believe in creating spaces where we can have open, honest conversations about women's health challenges. And today's session is exactly that, a real practical discussion about living with endometriosis and the strategies that can help you take control of your health journey. We also want to give special thanks to Myobi for generously donating two of their portable TENS heating belts, the Apollo and Artemis. They are wearable heating belts for pain relief on the go, and we'll be giving these away to two people who signed up, and we will announce the winners tomorrow. But before we dive in, just a couple of reminders left, I promise. First, this program is for educational purposes only and is not meant to be a substitute for medical advice. Also, your feedback is invaluable to us, and we're committed to making these programs as helpful as possible for you. So after the program, you'll receive a brief survey link, and we greatly appreciate your input on both today's session and topics you'd like us to cover in future programs. And now I'd like to introduce our three amazing panelists. First, Dr. Allison Triconde. She is a board-certified physical medicine and rehabilitation specialist. She's also the Chief Medical Officer of Pelvic Rehabilitation Medicine, and she's a leading expert on pelvic health and sexual health. So, Dr. Triconde, can you tell us a little bit more about yourself and specifically what drew you to this field and what is your approach with patients?
Sure. Thank you so much for having me. My name is Allison Triconde. Yeah, so I originally got interested in this field when I had my own issues with pelvic pain, really around my first child. It was really classic kind of postpartum pelvic pain and pelvic floor muscle dysfunction that we see quite often at PRM, pelvic rehabilitation medicine at PRM. And I was just fascinated and realized, there was a need for really something that was more office-based, a procedural approach that was not quite pelvic floor PT, but not quite surgery. So that's really where I came up with the PRM protocol, really to treat the nerves and the muscles of the pelvis to rehabilitate them. So more of that rehab approach, not really a pain management approach.
Wow, that's amazing. Thank you so much. Next, we're excited to welcome Sarah Ray. Sarah is an endometriosis nutritionist and registered dietitian. She specializes in endometriosis symptom management and fertility nutrition. Sarah, thank you for joining us today. Can you tell us a little bit more about yourself? And I believe that you got into this field because of personal reasons.
Yeah, absolutely. Thank you so much for having me. I'm really excited to be a part of this discussion today. And yeah, I've been a registered dietitian for several years. And I found out that I had endometriosis kind of midway through my career journey. So just actually a few years ago. And a part of my journey was learning about how food can impact symptom management. As a part of my story, I had horrible endobelly, food intolerances, pelvic pain, kind of heavy bleeding, all of the classic symptoms. And as I started digging deeper into it, the different endometriosis diet books out there I found were really restrictive. So I have spent some time working in the eating disorder space, and that was really concerning to me, thinking about maybe parents trying to help their teens deal with endometriosis symptoms and putting them on these really restrictive diets. And so that was something that I really saw as a need in our community. And I really wanted to help people as a part of my story as well to find the right endometriosis care and the right diet for endometriosis. Because if we're cutting out everything, that's only going to increase our stress levels, not make us feel better.
And last but certainly not least, we have our patient advocate, Emma Maxwell. Emma, can you briefly tell us about your own personal story? I believe it was years before you were able to get a diagnosis. So tell us, what were some of those symptoms you first were experiencing and what ultimately led to you getting a diagnosis?
Absolutely. For me personally, I felt the onset of my symptoms around age 13 at the start of my first period. The first telltale signs for me that I actually normalized for a very long time was incredibly painful and heavy, irregular periods. I would go to middle school and bleed through a tampon, a pad, and my pants within the matter of hours. And everyone in my life told me that that was normal and that I just needed to suck it up, and that's part of being a woman. And around age 15, I started to seek help from doctors, medical professionals, because it only seemed to be progressing with age and with time. Each cycle just felt like it was getting worse and worse. And I didn't really know anyone else in my life that was going through what I was going through. So I went to my primary care. I expressed my concerns about my super heavy, painful periods, and I was met with, well, that's normal. We'll put you on birth control. And I cycled through 10 plus different birth controls from the ages of 15 to 19. They were just rapid cycling me through, and my symptoms only seemed to progress, the ones that I had initially been feeling, as well as the side effects from birth control. And I had brought up to my doctors I was going to specialists because my GI tract was also heavily impacted. I've grown up with constipation, chronic constipation, and that's also been written off as something that was normalized. So all of these things that I was going through in middle school, in high school, and then into college, so much of it was normalized. It's still normalized to this day, even with my endodiagnosis, among other conditions that I live with. So once I finally got a diagnosis after seeking help from countless medical professionals, going to ERs, being sent home with no help, being told to just take an Advil, as if that's not something that I had thought of before seeking help. I had an OBGYN who said that he thought I had endometriosis. I kind of laughed it off because I was like, I've already brought that up to my doctors before. Like, I don't have that. I'm too young. And he was like, well, did you have a surgery? And I said, no. And he was like, okay, we're booking you for a surgery 2 weeks out. I got that surgery. I, at the time, didn't know the importance of seeking help from an endometriosis excision specialist. So that surgery actually caused me far more complications in the long run. I'm so grateful that I got my diagnosis, though. So from there, I think that that was the jumping point of wanting to explain to the people in my life that didn't understand and kind of wrote it off as normal, and just kind of explaining what I was going through, which is why I created my account Endometriosis M. It was really for my friends and family to better understand a space where they could go to, because there is so much misinformation surrounding endometriosis, women's health, all of these different things.
Thank you, Emma. We are so lucky to have you here today. And thank you for telling us about your story and your experience. You know, kind of segueing from there, you know, you were just talking about there was a lot of different treatment options and you weren't really sure, you know, where to go. I think there's a lot of, you know, endometriosis patients, women who feel the same way. So kind of starting with the different treatment options for endometriosis. Dr. Srikhande, first, what are some of those options?
Right. So for management of endometriosis does not have a cure. So rather than treatment or management, we would describe it as there's two buckets, right? There's the non-operative medical management bucket. Then there is the endometriosis surgical option. And in the non-operative bucket, you would put, there's options for hormonal suppression. There's, of course, lifestyle, right, which is exercise, diet, sleep. And then there's also what we do at pelvic rehabilitation medicine, or PRM, is where we're conceptually treating the central sensitization that comes with endometriosis with the peripheral nerve sensitization or neurogenic inflammatory process in the pelvis, with the myofascial pain and dysfunction. So it's that triangle that we're addressing at PRM in a non-surgical way, right? An office-based procedural protocol, working to treat the pelvic peripheral nerves with the central nervous system and the myofascial. Working with pelvic floor PT, as well as our specialists in a non-opioid way as well, where if you are using medications, it would be medications directed at the nervous system called neuromodulators, and or medications directed at the bladder, right, which can happen. And then, of course, working on the bowels, either through some diet and sometimes supplements such as psyllium husk or magnesium. So that would be kind of our non-operative. And then a lot of times it's working with surgery for the best outcomes, right? And within the realm of surgery at PRM, we are very careful. We only hire excision surgeons to help our patients, surgeons who are doing excision surgery, who have a fellowship in robotic surgery, right? Robotic endometriosis fellowship trained surgeons to work with us for patients that do need it. Either they come with a more advanced disease process, or the non-operative medical management is not working for them. And conceptually at PRM, our goal is to decrease the total number of surgeries our poor patients have to undergo in a lifetime, right? Really trying to do as much of a definitive surgery as we can, and then working with patients both pre and post surgery. We call it prehab and post-hab, really, again, conceptually to treat the peripheral neurogenic inflammatory process in the pelvis, because we know endometriosis, it proliferates, it grows when there's inflammation. So conceptually, if we can mitigate that, we're trying to prevent multiple surgeries in a row.
Are you able to break down just the differences between ablation and excision surgery?
Yeah, so the difference is in an ablation surgery, it is a burning of the more superficial layers of the endometriosis plaques, whereas an excision surgery is describing it almost like a deeper carving out to really get to that, try to get the root out, I would say, of the endometriosis plaques of where they are.
Wonderful. Thank you. We do have a question as well from Clarabelle C. She asks, I am wondering about different types of birth control since it is my only option right now. Also wondering on any tips on standing up for yourself in a doctor's office when you're not believed.
I mean, classically for our patients, the most common, particularly when they're undergoing an endometriosis surgery, is the Mirena IUD. Is placed intra-op most commonly. So the IUDs are something that are placed and left in. That is, I think, a great option for patients. But really, it's so specific because certain patients tolerate certain things. It's not really a one-size-fits-all with any of these treatments, of course. But for hormonal suppression particularly, there is, classic oral birth control methods. It works well for some patients. Low estrogen seems to work very well for many patients, but again, it is specific to the patient. The NuvaRing is another one that some patients like, given they find there's less side effects with that. But really, again, that is patient specific. And then, of course, there's with the hormonal options that are not birth control. Those GnR agonists and GnR antagonists are options as well, but they would put you into an early menopause, which comes with its own side effects, right? So the challenge with hormones is the side effect profile. So for us at PRM, we're not pro or anti. It's just, I do think you need to do things in a multimodal fashion, meaning multiple things at once to use the least amount of hormones possible to minimize the side effects.
Wow, that's really interesting. And Emma, too, I know you've had experience with this. Anything you would like to add?
I think the most important thing is finding individualized care, which I think goes off of what you were just saying, is finding the right modalities for different people. And some people find that some things have side effects and some people find that it helps them extremely well. And birth control was just something that didn't work with my body, but it's not something that I write off because I know so many people in the community that use and are very grateful for birth control or hormonal treatments. I did do medically induced menopause, which was not a great experience for me. But again, I hear from people in the community that it is something for them that works, or the Mirena IUD worked for them. I had the Mirena IUD placed after my first surgery and had it removed 6 months later just because it wasn't working with my body. So I think if you're looking for treatments, understanding that you know your body best and that what works for someone might not work for you and you're not doing anything wrong. I just wish that I had seen an endometriosis excision specialist from the jump, or just that there was that information out there that that's what I should have been looking for. Because I think that so many doctors claim that they can perform, or OBGYNs can claim that they can perform a surgery for endometriosis. However, it might not be the care that you need, that you deserve. So doing your research, and understanding that you're not doing anything wrong if things aren't working for you.
Thank you. We do have another question from Sydney G. She asks, what is the endo excision recovery like? I'm scheduled to get my first one in December. So, Emma, if you want to share your experience with your surgery recovery, and then Dr. Shrikande too will kind of go on, from there about more of pain management and also surgery recovery as well.
Yeah. So with my excision surgery, I was told that I would be like feeling better after 2 weeks and that I'd be able to go back to work if I was working an in-person job, which at the time I was not. And I'm very grateful because it took me far longer than I had anticipated. And recognizing that you're on your own timeline is incredibly important with recovery, because I feel like putting it into a general bucket of, well, you're going to be better in 2 weeks, or you're going to start feeling better. Like, I started walking downstairs with the help of a cane, a railing, and someone like holding me, where I was under the impression that that's when I was going to start feeling better and I'd be driving and doing these different things. So it's just so different. Just like the individualized care, the healing process can be so incredibly different, and giving yourself grace with that, because it took me 8 months to start walking up and down stairs without having to think about it, because I did have some issues with my leg, and that's not going to be the same for everybody. But a lot of people, I feel like it's said to us like it's going to be like this easy process, and for some people it is, and I'm not trying to scare anyone, but making sure that you're giving yourself the support and the time that you need, and not pushing yourself to do things, because you're not going to heal if you're pushing yourself. So
thank you. Dr. Shrikande, anything to add?
Great. Okay. Yeah, no, I want to echo Emma's comments about endometriosis healing postoperatively. It really is unique to the individual case and patient, right? Where the endometriosis was found, the extent, as well as, everyone's body does heal at a different rates. So it definitely varies. One thing I would like to say that our data, which we are collecting and publishing on, two things that seem to be helping. One is something called the prehab, which I alluded to briefly, but conceptually prehab in the world of rehabilitation is pretty common in most surgeries. And for hip surgery, spine surgery, we're very involved in the rehab part before surgery, prepping a patient. And we're trying to bring it to the gyne surgery world at PRM because it works so well in other surgeries. We should probably be doing it for the gynecological world as well. But conceptually, you're really wrapping patients' nerves and muscles up in a nice bow, right? Less inflamed, less irritated, less spastic, which means they would be stronger, right? Because spastic muscles in the pelvic floor are weaker. So conceptually, we're trying to make them bounce back faster after surgery with prehab. And our data is showing they are, right? Post-operatively using less opioids, if sometimes not having to use any at all, going back to work faster, return to function faster, bowel, bladder, intercourse, exercise, sleep. and quality of life. So that is what we really are trying to get out in the world is prehab at PRM. And then of course post-operatively, what we'll do is the patients will come in and also, other than speaking with their surgeon, speak with our non-operative pelvic pain specialist. And quite often, patients, the surgery went fantastic. All the endometriosis plaques were properly excised and removed. But if you can imagine, the endometriosis was there for many months and usually many years, right? So even if you remove that inciting event, which is the endo properly, you're quite often your peripheral nervous system, your central nervous system, and your myofascial system need a little help still, right? So then, sometimes patients have 3 or 4 issues around pain with bowel movements or urinary urgency, pain with intercourse, lower abdominal pain, and 2 or 3 went away right away, but 1 or 2 can be sticky, and that's okay. So we would address whatever persistent comorbidity would happen or persist post-operatively. So it's a lot of reassurance and letting patients know, then we can just address whatever maybe persists after surgery.
And we do have a question from Jana S. She asks, how can I tell if the pain I'm having is from endometriosis or adenomyosis or something else like bowel issues or even digestive problems?
Right, and that's a great question, and it can be tricky because endometriosis, how it presents again can be different in many people. But I would say the first question, endometriosis versus adenomyosis. I mean, adenomyosis typically is something that happens definitely around the menstrual cycle quite often, but sometimes it can be a bit more localized pain than endometriosis itself. But sometimes not. Again, there's something in the pelvis called it's cross sensitization or visceral somatic and visceral connections, meaning organ to organ and organ to nerve and muscle and things. So it can get a bit misconstrued for everybody. So there's not so black and white is one because of that. And then in terms of endometriosis pain versus pain from the eating something off like their bowels, that would be more taking a proper history of a patient, right? Did you eat something different that day that wasn't in your norm, and then did that correlate with your symptoms? So that's more from taking a history. But no, these are all great questions. I mean, and it can be challenging to decipher because when endometriosis pain is there for more than 6 months, there changes do happen in the nervous system, peripheral and central. And these connections, these interneuronal connections, do happen that can cause a bit of a disarray with signaling and pain.
Thank you so much. I think that's really important to go over. So thank you. And kind of then transitioning into other forms of treatment, and even you mentioned at the beginning of the program, how does physical therapy or alternative pain relief methods, how can those also be options for treatments?
Yeah, so at PRM, we work closely with pelvic floor physical therapy. So again, we believe in a multimodal approach where we work together as a team, but the key is simultaneously, because unfortunately what's happening now in America is a bit of a piecemeal approach non-operatively, which I think can be challenging, where patients will try some pelvic floor PT, they'll try some acupuncture, they'll try some suppositories, but never simultaneously. So that is what has been our secret sauce, is working together, doing our simple, office-based PRM protocol, which is a tiny 27-gauge needle, similar to an acupuncture-sized needle, so very safe and no anesthesia, just go on with your day, working with pelvic floor PT at the same time, and then any adjunct therapies in terms of nutrition, mindfulness, meditation, and then adjunct medications based on the patient that are, of course, non-opioid. But that is the key. We're all doing the same thing, really. Pelvic floor PT is doing exactly what we're trying to do. Central sensitization, peripheral neurogenic inflammatory process, and then the myofascial pain and dysfunction, all at the same time. But we really have the same goals. It's whatever tools you have in your box you use. And I think the secret sauce is to work as a team at the same time and treat together.
Thank you so much. Emma, anything to, add to this of anything that you've done that's also been helpful, especially I think the message is, I love that. It's the secret sauce of kind of trying all different things. Is there anything that's really helped you too?
Well, pelvic floor physical therapy has been a game changer for me, as well as physical therapy in general, working on strengthening my body. I lost a lot of muscle and different things because I was in so much pain. So building back that strength has been something that's been incredibly helpful. Um, Changing my diet has been huge for me. I am gluten and dairy free completely, and I have been for about 4 years at this point. And that's been something that's been incredibly helpful with generalized inflammation and just feeling better because I had a lot of bowel and stomach issues, GI issues. But that has been very helpful for me. And then I think, yeah, doing things together, because I did do little bits and pieces like the acupuncture. And then I would do, okay, I'm working with a naturopath. Okay, things aren't working here. Now what can I do? But I think now I have a multidisciplinary approach where I work with different doctors that help me with different things and working on my diet and all of these different facets that make me who I am and help me to manage things all at the same time, is also incredibly helpful.
So, Sarah, talking about nutrition, kind of going into and segueing into this section, first, if you could just kind of tell us a little bit. I know there's a lot of different approaches when it comes to each patient you work with, but I think just an overview of really how can nutrition really help and complement these treatment options?
Yeah, I think that with endometriosis, we have this multidisciplinary approach, and a lot of what we're focusing on is like getting people to relax their bodies and making sure we're well nourished. I think the main message is like there's nothing that's like a magic bullet for any of it. Like we have to look at our lifestyle, we have to look at making sure we're eating enough nutrients, enough of specific foods. And we have to look at individual symptoms. So we have a really large portion of the population that has endometriosis. And so there's going to be some crossover in people who have gluten intolerances from other conditions. So whether that's like celiac disease, people with Ehlers-Danlos syndrome often don't tolerate gluten very well, but gluten and endo are not necessarily the issue. I eat gluten, dairy, and sugar every day, and I live almost pain-free. And so I think that just having a blanket information out there that you need to cut gluten and dairy to be symptom-free for endo is incorrect for some people. And so we really have to look at what else is going on in your body, what gut symptoms you're having, what your family history looks like, to really address what you need to do to target your symptoms.
Yeah, we actually got a question from Mary Lynn. She says, I have two teenage daughters, both diagnosed with endometriosis and one who also has celiac. Just generally interested how to support them both since their experiences have been very different.
Yeah, and so we know celiac disease runs in families, and so if you have a parent or a sibling who also has celiac disease, even if you're not presenting with classic symptoms, it could be good to get tested. And if you have celiac disease, yes, you need to avoid gluten and you need to be really careful about cross-contamination. If there's no celiac and you're having a lot of food intolerances, making sure you're healing your gut is what I focus on with my patients. So when we're on a lot of antibiotics and we have chronic inflammation and chronic stress, we start developing all of these food intolerances. And so I often see people coming to me that have cut out gluten and dairy and sugar and eggs, and they're also panicked about nuts and things like that. And the more things that we cut out, the less we're feeding those really good, healthy bacteria, and we start to develop even more food intolerances, and we start to develop skin issues and things like that. And so if you don't have a medical need to take something out, such as celiac disease or a true allergy, I would say, what can you add to your diet? What good things like fruits and vegetables and color and fiber and probiotic rich foods can you add to help improve your symptoms rather than keep taking things away, because it just becomes more and more restrictive and more stressful and hard to meet your nutrient needs.
Bree asks, how do I know what supplements to take?
That is also really individualized. With what we know with endometriosis pain is when people are getting enough omega-3 fats, that is associated with reduced endo pain. And I see a lot in the American diet that we're not eating enough fatty fish. And so I always like to start with food first. So if you're not getting enough omega-3s, trying to get like 2 servings a week of good fatty fish and trying to get, walnuts and chia seeds and flax seeds in. But if you just hate it, can't access it because you live in a rural area, whatever those reasons are, that might be something to look at. Um, we're also tend to be low in vitamin D in the US. Some people need probiotics, but not everybody needs the same one. And so it's really something that you need to work with a healthcare provider on. And I encourage people to get their labs tested before you start supplementing, because there's things out there that can be toxic in high doses. Even with some multivitamins that are out there, we can get too many B vitamins or too much vitamin D, too much vitamin A. And so, again, it's not a one size fits all.
Thank you. Kind of going to the topic of surgery, either before or after, is there anything you recommend, or would the diet change if you're prepping for a surgery or recovering from a surgery?
Yeah. So I think that there's a couple of different things with that. When people know that they're going to go into surgery and they're having really horrible gut symptoms, sometimes I will have them do an elimination diet to start with, just to get some of that initial pain from bloating down. But we have to remember that elimination diets are a Band-Aid. So that should be kind of under the care of a dietitian or a doctor that's kind of making sure that you're reintroducing things back in later on. But that prehab approach that is also happening, I think, really is important for nutrition as well. So making sure that you're going to surgery really well nourished with protein and vitamin C and zinc and those just kind of base minerals. Having as much good healthy bacteria as you can going in is really important. So making sure you're eating throughout the day, you're getting breakfast in, you're eating protein at every meal is going to really set you up for success for healing after that surgery, because we have these small little incisions, but it is really extensive. And I think that's something that people don't realize, that, it's not this big leg cut that we have or a big burn or something, but we're still needing protein to help support replenishing those nutrients and vitamin C and zinc, and all those vitamins for wound healing internally.
Thank you. And, if someone is trying to really figure out, okay, I want to find a nutritionist to work with while I'm going through my treatments, really maybe find what helps with my symptoms, what does that look like? What is that first step of, really trying to target what foods help or maybe don't help, and then also finding someone like a nutritionist that can help as well?
Yeah, I think the most important thing with any healthcare provider with endometriosis is finding somebody who listens to you and connects with you and wants to understand where you're coming from. I think that food is a really personal relationship. And so having somebody that you can really relate to, so doing those discovery calls and making sure you feel comfortable being vulnerable in that space with them is going to be really helpful, because lots of women have disordered eating or food issues, or sometimes with our approaches of trying to get our symptoms better, we can develop bad relationships with food. And so we need to feel safe in that space that we're talking about it. So I would say that's number one, is find somebody that you're comfortable with. If you're kind of looking at specialties, looking at people who specialize in irritable bowel syndrome or gut health, they are going to have approaches that really work on kind of healing your gut, improving your symptoms, improving pain. There's dietitians who also specialize in heavy periods, or holistic nutritionists who also specialize in those things. So people who are looking at kind of women's health or gut health issues is probably going to be the most helpful. And then people who focus on intuitive eating. So the last thing we want to do is keep adding restrictions in. And so having people who are going to help you kind of tune into your body and tune into your symptoms and figure out what works for you and what feels good for you is going to be more helpful than somebody who just hands you a meal plan and says, just eat these things and you're going to feel better.
And kind of one other thing you and I had talked about as well is even something as far as like with meal prepping. I know there's times that maybe women with endometriosis, they can feel the pain can just be really bad one day or for that week. And then the thought of, Emma, I've heard this from you too. It's like even the thought of standing or maybe cooking is just sounds unbearable. So, are there things that, women can do to maybe help with that meal prep or really follow the nutrition that they're hoping, because it does help their symptoms, but it does take that time to cook?
Yeah, I think if you know kind of your cycle, like you're going to feel really bad in that week leading up to your period or on your period week, kind of leaning into that time that you do feel really well and meal prepping at that time can be really helpful. So maybe in that week after your period where you're feeling vibrant and full of energy and you're cooking for yourself, prep extra and pop it into the freezer. So, like, if you're cutting up some chicken breast, pre-slice it so it's just ready to go and pop it in, or even prepare that whole meal and maybe double it so you have a meal ready to go for the future. Leaning into pre-made foods. I love to do like a rotisserie chicken and a bag salad and a piece of fruit, like very easy, ready to go. You don't have to do a whole lot around it. Soups can be really helpful. So, again, try not to demonize foods. And when you're not feeling well, just making sure you're getting something in and thinking about where you can get kind of quick and easy sources of protein. But for me in my journey and kind of leading up to surgery, trying to just when I was cooking, doubling the recipe and saving it for later, or kind of making sauces and having them ready to go for marinades for the future. That can be really helpful, and just stocking your pantry with things that you know that you'll eat when you're not feeling well, so you have something easy to grab and go. So maybe that's oatmeal. Like just eating something is better than not eating at all when you're not feeling well.
Yeah, Emma, anything to add, about this topic or anything that's helped you?
I think everything you just said is so on. Like I'm sitting here shaking my head because I'm like, yes. Something that I do to prepare for my period is I do meal prep, and I will cook extra when I am feeling well and pop it in the freezer or make a big batch of soup if I'm feeling up for it right before my period, so that I know that there are veggies in there and there's bone broth and there's chicken and there's these different things that I know that I'm getting nutrients from, because it can be really hard for me to even think about standing up, but even getting food in my system can be super hard when I'm in a lot of pain, but it's something that's necessary. Some food is better than no food, like you said. And sometimes it's even as easy as I just had someone cut up a bunch of apples for me before my period and they dropped it off. And I was like, yes, okay. Now I have something that's so easy to grab. And preparing snacks, I keep snacks in my pantry. And then I also keep some under my bed if there's no one that can be around to help me. So I have go-go squeezes or like different applesauces or some chips, different things like that. But also the meal prepping, freezer meals, if you're not feeling up to cooking, is something that I do. And then also sometimes I just do like Uber Eats or something like a food delivery, which is also super helpful. And I feel like I had a lot of guilt surrounding that for a while, but food is important and you need to remember to eat, especially when you're not feeling well, because your body needs that to heal and to feel better.
Thank you, Emma. As we wrap up our conversation, thank you all so much. What a wonderful conversation. But I would love to leave it to you as far as your key takeaways from each one of you of what you really are hoping each person who's joining us today goes away with. So, Dr. Shrikande, if we could start with you.
Great. No, I think key takeaway would be that endometriosis is a systemic inflammatory disease process, right? So it is important to kind of remember that and definitely take a comprehensive, holistic approach. And also to give yourself grace because, you're doing everything you can. And I think it's important to communicate with your healthcare providers as well as your family and friends so that your world around you, understands that what you're going through because you can't see it. It's invisible, very challenging.
Yeah, I think that with nutrition, it absolutely matters and can make a really big difference in how we feel. But the more you add nutrients to your plate, it will kind of crowd out those processed foods and some of those things that we've been told to avoid and can be really inflammatory. And there's room in our life to enjoy a piece of cake or enjoy, a milkshake if you tolerate dairy and not feel guilty about it. And this is a disease, as they've said, that there's no cure to it, and we need to just make sure we're being fed and taking care of our whole system. So it's not just about the food, even though food matters.
Well, I've said it, I think, multiple times in this call, and I say it all the time, but you know your body best. And I think it's important to communicate what you're going through with people that you feel safe to do so, because it is invisible and people just won't have the insight or understanding on how to support you or how to educate themselves or just a general understanding of what you're going through. So communicating your needs and allowing yourself to make modifications and surround yourself with people that feel supportive to you. The online community has been incredibly supportive, and I wouldn't be here today if it wasn't for the online community. So finding safe spaces, whether that is family, friends, online, creating your own safe spaces if you don't necessarily have one. There's such a need for that, but you know your body best. So advocate for yourself. You're not rude or abrasive for saying that you want to do more research or that you need to think about things, or you have control of the things that you do, treatment, everything. So
thank you so much to our three panelists. And also thank you so much for joining us today. Your engagement and your questions have made this such a meaningful discussion. Also, remember to check your email tomorrow for the announcement of our MyOB10s heating belt winners. And in just a few minutes, you'll receive an email with a link to our feedback survey. Your input is incredibly valuable as it helps us create programs that truly address your interests and questions. And for those interested in continuing the conversation, please follow Her Health Voice on social media and join our community. Thank you so much again for being here today, and we hope to see you at our next program.